Did you know that just 30 minutes of walking a day can slash your risk of prostate cancer by up to 35%? It's not science fiction, it's science. Every step you take might be shielding you from one of the most common cancers in men. And yet, millions are unaware of how powerful this simple habit can be. Today, we're diving into the truth about exercise and its invisible shield against prostate cancer. I'm Dr. Isabel Lopez, a urologist specializing in male health and prostate cancer prevention. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. In this video, we'll explore the exact types of exercises that can protect your prostate, how often you need to move, and why waiting could be the worst decision you ever make. We're not just talking about jogging or lifting weights, we're talking about strategies that change lives. This isn't about becoming an athlete. It's about being here longer for your family, your goals, and yourself. And if you're over 40, this information becomes more urgent by the minute. Each segment will break down a specific type of exercise, from cardio to strength, to flexibility, and even pelvic floor routines. You'll learn not just the what, but the why, the real science behind prevention. Plus, we'll tackle common myths and what most men get wrong about prostate health. And if you think it's too late to start, think again. Whether you're 45 or 75, your body can adapt, respond, and heal if you give it the right tools. Let's begin this journey together with facts, not fear, and by the end, you'll know exactly what to do next. Follow the channel so you don't miss what's coming next, because in the next segment, we're going to expose why prostate cancer should be on your radar, even if you feel perfectly fine today. Prostate cancer is the second most common cancer among men worldwide, with over 1.4 million new cases diagnosed every year. If you're a man over 50, your chances of being affected increase dramatically. And yet, too many still see it as a distant threat until it's too late. Awareness alone isn't enough. Proactive action is the only path forward. The biggest risk factors include age, family history, and ethnicity. But lifestyle choices, like diet, exercise, and stress management, can influence how these risks unfold. Men who neglect their health routines often pay the price in silence, facing late diagnoses and invasive treatments. The key isn't just early detection. It's active prevention. Beyond the numbers lies a harsh reality. Prostate cancer can silently impact a man's quality of life. It can affect urinary control, sexual function, and emotional stability. Many survivors report feeling isolated and less confident, even after successful treatment. That's why understanding prevention isn't just about health, it's about preserving dignity and independence. It's also a silent disease in its early stages. That means you could feel perfectly fine while it's already developing. This false sense of security keeps men from seeking regular checkups or adopting healthier habits. But the science is clear: when you move your body, you shift the odds in your favor. Exercise is one of the few things in life that gives back more than it takes. And in the case of prostate cancer, it's a line of defense you can control. No pills, no surgeries, just commitment. The sooner you start, the greater your protection. It's not about fear. It's about choosing power over passivity. And here's where most men go wrong. They wait for a symptom. But prevention doesn't wait. In the next topic, we'll explore exactly how physical activity can reshape your hormonal balance, reduce inflammation, and activate your immune system, your body's natural cancer-fighting machine. Exercise does more than burn calories. It rewires your biology. When it comes to prostate cancer, physical activity plays a powerful preventive role by balancing hormones, reducing chronic inflammation, and boosting immune function. These internal shifts don't just feel good, they protect your cells at a molecular level. One of the key benefits is hormonal regulation. Consistent movement helps stabilize testosterone and estrogen levels, which can influence prostate cell growth. Unchecked hormonal imbalances have been linked to tumor development, but exercise creates a healthier internal environment, reducing that risk over time. Chronic inflammation is another silent enemy. It quietly damages tissue and creates an ideal setting for cancer to grow. Studies show that regular physical activity reduces systemic inflammation markers like C-reactive protein, CRP, lowering the chances of cellular mutation. Less inflammation means fewer opportunities for cancer to take hold. Your immune system also responds to movement. Exercise stimulates the production and circulation of white blood cells, natural killer cells, and other immune agents that patrol for abnormal cells. This constant surveillance is one of the body's most effective natural defenses against cancer progression. These aren't just theories, they are backed by data. Harvard researchers found that men who exercised regularly had a significantly lower risk of prostate cancer recurrence and mortality. Another study in the Journal of Clinical Oncology showed that just 3 hours of moderate activity per week reduced death rates in prostate cancer patients by over 60%. And here's the kicker, you don't need to train like an athlete. Even moderate intensity routines, done consistently, provide protective benefits. In the next section, we'll dive into the first category of these routines, cardiovascular exercises, and how they directly impact your prostate health. Cardiovascular exercises are one of the most effective tools for reducing prostate cancer risk. Walking, jogging, swimming, and cycling aren't just good for your heart. They actively support prostate health. By increasing oxygen flow and improving circulation, cardio exercises help flush toxins and regulate body systems that influence cancer development. The sweet spot for most adults is between 150 and 300 minutes of moderate aerobic activity per week. That breaks down to just 30 to 45 minutes a day, 5 times a week. Whether it's a brisk walk around your neighborhood or a bike ride in the park, consistency is far more important than intensity. What matters most is moving regularly. Cardio also helps regulate weight and blood sugar, which is crucial for hormonal balance. Obesity and insulin resistance are both linked to higher prostate cancer risk. By improving metabolism, aerobic activity reduces these threats, creating a less favorable environment for cancer cells to thrive. Let's not forget the mental benefits. Men who stick to a cardio routine report better mood, deeper sleep, and lower stress levels. That's important because chronic stress can suppress immune function and fuel inflammation, 2 key contributors to cancer progression. Cardio helps break that cycle. Another hidden advantage is vascular health. A strong cardiovascular system supports optimal blood flow, which can improve not only prostate function but also sexual health. For men over 50, this is often a welcome bonus that reinforces the long-term value of staying active. Join the members club and leave a super like if you're learning something new. And stick around, because in the next segment, we'll shift from endurance to strength, exploring how resistance training helps preserve muscle, regulate hormones, and support a resilient body after 50. As men age, muscle mass naturally declines, a process called sarcopenia. But losing strength isn't just about vanity or mobility. For men over 50, maintaining muscle is essential to hormonal health and cancer prevention. That's where strength training becomes a game changer in your long-term prostate defense strategy. Weightlifting, resistance bands, and bodyweight exercises like push-ups and squats all stimulate testosterone production. This hormone, when kept in healthy balance, plays a key role in regulating prostate function. A well-maintained hormonal environment makes the body less susceptible to abnormal cell growth. Beyond hormones, strength training also improves insulin sensitivity and lowers body fat, 2 major contributors to chronic inflammation. The more muscle you build, the more efficiently your body burns glucose, helping to stabilize energy levels and reduce cancer-related metabolic risks. And it's not about lifting heavy. What matters is progressive overload, challenging your muscles over time with controlled resistance. Experts recommend 2 to 3 sessions per week, targeting all major muscle groups. Short, focused routines of 30 to 45 minutes can deliver significant benefits without overtraining. Many men worry about starting too late, but studies show that even beginners in their 60s and 70s can see remarkable gains. Improved posture, reduced joint pain, better balance, and increased confidence are just some of the side effects. The key is to start light, stay consistent, and listen to your body. In the next topic, We'll explore exercises that are often overlooked but deeply important for aging well, flexibility, and balance routines. These movements aren't just about stretching. They help prevent falls, improve circulation, and keep you mobile enough to stay active for decades to come. Flexibility and balance might not sound as exciting as lifting weights or running laps, but for men over 50, they are crucial for staying active and independent. Movements like stretching, yoga, and Pilates do more than prevent stiffness. They protect you from injuries that could derail your entire routine. As the body ages, joints lose mobility and muscles tighten. This can lead to poor posture, chronic pain, and an increased risk of falls. Regular flexibility training helps counteract this by keeping connective tissue supple and your range of motion intact. That means you move better, recover faster, and stay consistent in your other workouts. Balance-focused exercises are equally important. Simple drills, like standing on one leg or doing heel-to-toe walks, strengthen the stabilizer muscles that keep you upright. These movements engage the core and improve neuromuscular coordination, reducing the chance of falls that often lead to long-term setbacks. Yoga and Pilates combine both flexibility and balance with controlled breathing and body awareness. These disciplines are especially effective at reducing stress, lowering blood pressure, and improving circulation, all of which contribute to a healthier internal environment for prostate protection. The beauty of these routines is their adaptability. You don't need to join a studio or follow complex sequences. Just 10 to 15 minutes a day can yield noticeable improvements. And as your body becomes more agile and stable, you'll find that strength and cardio sessions feel easier and safer. In the next topic, we'll shift focus to a lesser-known but highly effective set of exercises, those that target the pelvic floor. Often associated with women's health, these routines are essential for men too, especially when it comes to urinary control, sexual function, and post-prostate treatment recovery. Kegel exercises are often overlooked in men's health, yet they play a vital role in maintaining pelvic strength and function, especially for those concerned about prostate health. These simple yet powerful movements target the muscles that control urination, support the bladder, and influence sexual performance. The pelvic floor is a group of muscles forming a hammock at the base of your pelvis. Over time, especially after age 50 or following prostate treatments, these muscles can weaken. This leads to issues like urinary incontinence, reduced sexual function, and even lower back discomfort. Kegels offer a non-invasive way to strengthen this entire system. To perform a Kegel, tighten the same muscles you'd use to stop the flow of urine. Hold that contraction for 5 seconds, then relax for 5. Start with 10 repetitions, 2 to 3 times a day. It might feel awkward at first, but consistency builds both strength and control. And no one will even know you're doing them. They can be done anywhere, anytime. Studies show that men who regularly practice pelvic floor exercises experience improved bladder control and better sexual response. These routines are especially helpful before and after prostate surgery, as they aid in faster recovery and prevent long-term complications. It's important to isolate the right muscles. Avoid tightening your abdomen, thighs, or buttocks. Focus on the pelvic area alone. If you're unsure, a pelvic floor physiotherapist can help guide you. Remember, small daily actions can prevent big future problems. Join the Members Club. Drop a super like, follow the channel, and leave a comment if this was new to you. And now, let's bring it all together. In the final topic, we'll recap the key points and show you how to create a sustainable exercise routine that keeps your prostate and your whole body in peak condition. Join the Members Club. Drop a super like, follow the channel, and leave a comment. We've covered a lot of ground, and now it's time to put it into practice. Prostate cancer is a serious threat, but you're not powerless. By adding targeted exercises into your weekly routine, you take control of your health, one step, one rep, one breath at a time. We talked about the importance of aerobic exercises like walking and cycling, and how they reduce inflammation and regulate metabolism. Then we covered strength training, which helps preserve testosterone and build a resilient body. Flexibility and balance routines followed, showing you how to stay mobile and prevent injury well into your later years. And let's not forget Kegel exercises, small movements with massive impact. They are easy to do, require no equipment, and support your urinary and sexual health, especially before and after prostate treatments. These routines are the unsung heroes of male wellness and deserve a place in every man's day. The best part: you don't have to do it all at once. Start small. Walk 3 times a week. Add strength twice a week. Stretch in the morning. Layer these habits over time, and they'll compound into something powerful. You're not training for a marathon. You're investing in decades of health and vitality. Now it's your turn. What's the first exercise you're going to try? Tell us in the comments. Your answer might inspire someone else to take the first step. And if you found this video helpful, share it with a friend, a brother, a father, someone who needs to hear this today. Thank you for watching. Stay consistent, stay curious, and remember, your health is your responsibility. No one will do it for you, but the rewards are all yours.